Military help is on the ground here in Indiana to help doctors and nurses dealing with a surge in COVID cases and hospitalizations. Good afternoon, everyone, and welcome to 13 News at noon. IU Health says it has asked FEMA for support as we see more COVID patients needing care.
People don't seem to understand what's going on in hospitals in states like Indiana, and it is absolutely dire.
Now, that is Dr. Gabriel Boslett, who is an IU Health pulmonologist. He was on Rachel Maddow's show on MSNBC Monday night, saying that hospitals have never seen this many patients and expressed concern that with the Omicron variant, they could be overwhelmed.
It makes my heart race to think about what that could look like. I mean, it could look like people dying because we don't have enough places to put them and them just suffocating alone. It means, putting people, caring for inpatients in ambulance bays, which is happening in one of the hospitals here, in conference rooms, which is what's happening here.
This federal help is in addition to those Indiana National Guard teams who are also providing support in 19 hospitals across the state. And IU Health says it is continuing to leverage all available resources to support patient care. Here's what the FEMA help will look like. For the next 30 days, a 20-person clinical team of physicians, nurses, and respiratory professionals will be integrated with teams at IU Health. Now, this is all because of a surge in cases, especially the new and highly transmissible Omicron variant. Now, we know President Biden has announced new measures to ramp up testing while urging unvaccinated Americans to do their patriotic duty and get their shots. NBC's Hallie Jackson has the push just as millions of Americans gather with families over the holidays.
With the countdown to Christmas getting shorter across the country, the lines are getting longer from New York City to Cleveland, where this drive-through site filled to capacity soon after opening Tuesday. Frustrated Americans waiting hours for COVID tests, wondering whether to gather with family over the holidays as cancellations roll in for major public holiday events, all driven by the rapid rise of the Omicron variant. President Biden aiming to reassure vaccinated people they'll be safe over the holidays while delivering a stark warning to unvaccinated Americans.
If you're not fully vaccinated, you have good reason to be concerned. You're at a high risk of getting sick.
Facing more pressure to fight the latest wave of infections, President Biden says the federal government will set up additional testing sites in places where they're needed most. And starting next month, the administration will ship 500 million at-home COVID test kits for free to anyone who requests one. That's just a couple weeks after the White House downplayed the need for at-home tests.
Why not just make them free and give them out and have them available everywhere?
Should we just send one to every American?
Maybe.
Then what happens if every American has one test? How much does that cost, and then what happens after that?
The White House also directing the military to help in hospitals, which are quickly becoming overwhelmed. Doctors and nurses desperate as beds fill up.
Sometimes we're calling 20 to 30 hospitals a day trying to find beds for these patients. And a lot of times we have patients that sit in our emergency room for 3 or 4 days.
Hospitals in multiple states delaying elective surgeries as cases rise. Dr. Joe Gastaldo says bed capacity at his hospital in Columbus is tight, with the vast majority of COVID patients there unvaccinated.
Unless you live in a bubble or unless you live on the top of a mountain and don't have any contact with society, everybody has a date with this virus. I'm very concerned for people who don't have any degree of immunity.